Welcome, everyone. We'll call the Health and Human Services Committee meeting to order. And our first order of business is to accept the minutes of February 28th, 2024, moved by Sam, seconded by Mr. Hahn. And any discussion? All those in favor?
Aye.
Opposed? Motion passed. Next, we have public health. We have a list here.
Sorry, apologize.
Good morning, Alyssa.
Good morning. Okay. Just a few things for today. So our first item is to recognize the chronic disease self-management program revenue. Per the treasurer's request, we are requesting a resolution to recognize $400 of revenue for the chronic disease self-management program.
Okay, so I think that would be referred to finance.
Did we move to finance? Is that what you
Yeah. Dana, second.
Dana made it, I'll second.
Any discussion? All those in favor?
Aye.
Opposed? Motion passes.
Thank you. Our second request is to apply for the Child Passenger Safety Grant. This is a grant we've held for quite a long time. Annually, we need to reapply in order to supply car seats for people in need. We also do car seat checks and car seat tech training classes through this grant. The amount is usually around $15,000, but could fluctuate. So we're just asking for approval to apply for that grant again.
Motion, second. Any discussion? All those in favor?
Aye.
Opposed? Motion passes.
Okay, and then some program updates. Probably you did hear, we did have to reschedule our Whitehall Rabies Clinic due to the blizzard we got on Saturday. So that has been rescheduled in Whitehall to April 13th. Registration for that will open on April 3rd on our website, or people can call our office. We have been putting out messaging on our social media to get that out to people that is rescheduled, but they will have to re-register for that. And then the next clinic is in Granville on April 20th. Registration will open for that on April 10th. But that was the Whitehall Clinic was very popular when everyone signed up for the March one that got rescheduled. It filled up within like 2 days, so we're hoping it fills up again and we'll get some coverage in the northern end of the county. As far as communicable disease updates, the biggest thing is there was another health advisory notice from New York State yesterday regarding measles. There have been a few cases in New York City in 2024. Now there is one case outside of New York City in Nassau County in a young person. I don't think we have full specifics on that yet, but one case outside of Nassau County or in Nassau County. Total for the US this year as of March 14th, there were 58 cases of measles across the country, including New York City. Obviously, there are more since March 14th, but that's the latest that CDC had data. And just to compare that, in all of 2023, there were 58 cases of measles in the entire US. So we are monitoring closely. Flu cases are luckily going down, as well as COVID and RSV. We're getting very few reports of those as well, so that's good news. We do have a couple of handouts if anyone wants to take. There is a remote area medical clinic. This is not sponsored by Public Health, but I do have some flyers. They are looking for volunteers. If anyone wants to post those. That's on April 6th and 7th at Hudson Falls High School, and that's to serve people that maybe don't have medical providers, don't have medical insurance, all for free. It's a different, another company that comes in and does it. They used to do it at the Washington County Fairgrounds. And then these are posters with to post for people to go to the clinic with little tear off tabs on the bottom. Promotional items, we're also requesting promotional items for our tabling events and at the Washington County Fair. Items are for bike safety booklets, sunscreen, hand sanitizer, yo-yos, sunglasses, punch balloons, wooden cattle balls, and wooden nickels. Some of them are toys, and the reason that we're doing that is this year is the 100th year of public health in Washington County. So we thought it would be fun to hand out at the fair some little branded items celebrating 100 years of public health.
So those will have the county logo on them, and that's.
The county logo or the public health.
Okay, so
We're looking for approval for that. The funds are already in the budget for those
Do you know what the
items.
exact date was of the anniversary?
I did pull some newspaper articles. I don't know it off the top of my head. I want to say it was June of 2024 and it originally started with a TB clinic. Yeah, I can send you that if I can find those and send you that information. Yeah.
Okay. We need a motion on
We need a motion, to approve the
that.
branding.
Move second. Sam, any discussion? All those in favor?
Aye.
Opposed, motion passes.
Thank you very much.
Thank you.
Elijah, the measles, are those cases only in people that are unvaccinated?
For the most part, or I believe from CDC, they've said there have been cases in people who only have one vaccine. So in the information that came out yesterday, we did just get clarification from the state today that yes, I'm not sure if it's the state or CDC is now recommending. Or I gotta look at it again, but they're slightly changing depending on the age group, the recommendation for measles vaccination. However, if people were born before 1957 or have definite documentation that they had measles as a child, then they're considered immune. If you've had measles once, you do not typically get it again. So if we, depending on more guidance from the state, we may put more information out on guidance for those born 1957 and later. But primarily the most high-risk age group are infants under 6 months old, because they're not eligible for the vaccine. Infants 6 to 11 months who are traveling internationally should get a vaccine. And then the typical age for the first vaccine is 12 to 15 months old. So anyone in that kind of 1 year group is high risk group.
We would like to see boosters come out for people born after 57.
Not necessarily boosters if you have proof of immunity or proof of previous vaccines. And most people who have attended public school or college, at least in New York State, do have to show proof of vaccination to complete their education. So
Thank you.
good questions. Thank you.
Thank you. Okay, next we have ADRC, Gina.
I would like to start with a request to appoint Julian Hadley to our Office for Aging Advisory Council to represent Cambridge.
Motion, and second by Black.
All in favor? Aye.
Welcome to my world. Hey,
All
was thinking, Sam, that we don't need the boosters.
No.
Earlier, so I'm focusing on that. All those in favor?
Aye.
Opposed, thank you.
I have a couple of dates on events that we recently facilitated. On March 14th, we had our intergenerational event with Argyle School. We facilitated an senior high school drama club performance for the dinner theater. And the school's drama club did great. They performed Disney's High School Musical Junior And we had some student council members come and assist us in taking care of the dining room. So just to know that we did successfully sell 135 tickets to that event. So that is definitely going back to pre-COVID days. So we're very excited about the attendance. On March 22nd, we had our March for Meals campaign, and most certainly I'd like to thank Supervisors Baker, Hahn, Hogan, and O'Brien for attending. Thankfully, we had a full day scheduled with some individuals. I know that Supervisor Hogan and Supervisor O'Brien also delivered meals that day, so that was much appreciated, and we were able to give individuals a tour of the jail as well. Again, it was the support on that day was tremendous and extremely appreciated. We had several department heads also attend, and Under Sheriff Winchell was great in helping us with some guidance for the event. So I had the opportunity to spend the day with the New York State Office for Aging Director Olson, and we had him serving in the kitchen along with Supervisor O'Brien. And following that, we went out and delivered meals to residents at the Oaks, and then went to serve lunch at the Kingsbury Fort Edward Senior Center. So it was a great opportunity to really highlight Washington County and all the wonderful services that we offer here. And his impression was greatly impacted by the collaboration that he had seen between all the departments. Most certainly, he felt like the camaraderie between everyone who attended was outstanding. So we definitely made a great impression to our state representatives. So thank you. We did do a Facebook post. So on the Facebook post, I did share some pictures out with individuals. But most certainly, if you want to see the full caption of the day's event, please go ahead and visit our Facebook post on that. So thank you. I'd like to share a couple of service updates as well. Our Community Connections newspaper is a monthly supplement, and the Free Press serves over 22,000 households. Our agreement with the current provider expires on April 31st. I went ahead and followed the procurement process and sought out quotes from local providers. And at the conclusion of the proposal request, I received 2 quotes, and the award will be going to the lowest proposal, which will be the current provider, which is Capital Region Independent Media, also known as NYBT Media. So at this time, our service in printing the Community Connections paper will go uninterrupted. Move on as such.
Gene, who's currently doing it? Same organization?
Correct, it will be the same organization. Used to be known as Manchester Papers.
So it comes out in the Free Press.
Correct, yep, it's a supplement within the Free Press. So it not only gets distributed to households, it also gets distributed in businesses and stores, so people can obtain the papers. It's a great avenue for us to share information from not only our department, but for many other departments as well. The next service update I have is to share with you that Office for Aging contracts with several personal care agencies. And one of those agencies is Visiting Nurses. Recently, Visiting Nurses asked for a personal care hourly rate increase. They have not received an hourly rate increase since 2013. The rate increase that they requested is within our budget. Given the age of the agreement, 2006, I would like to request a professional services waiver to update the entire agreement with Visiting Nurses.
What's the change in dollars?
Currently, we are paying $20 for personal care level 1 and $23.53 for personal care level 2, with a 35-cent mileage stipend, and they are asking for $35.55.
For which one?
For both.
Both of them? So each category is is separate, so the one that was 20 is now gonna be 35, and the one that's 23.50 is gonna be 35. Okay, just
So they are.
$70.
We have, approximately 264,000 total funds for personal care, level 1 and level 2. I can share with you that we haven't used this provider in quite a few years, just because of the lack of, their workforce in our area. So right now at this time, just in our own budget, which we're able to shift around if needed, we have $600 budgeted for this provider.
Any motion for finance, is that what we do?
Yes.
I'll make a motion to move finance.
I just have one question.
I'll second.
Does you get any insurance money back if a patient has insurance? Can you bill the insurance company for visiting nurses?
So we have agreements with managed long-term care insurance providers for the service of home delivered meals right now. So we're not billing MLTCs for personal care. But right now, just our home delivered meal
Or if
service.
someone has surgery, they need visiting nurses, they'll keep them out of the hospital. You get, does insurance pick up any of that cost?
There are different services. So when you're talking about personal care, there are certified home care agencies that provide services for individuals who leave the hospital and go back into the home, which are pretty much similar to our personal care assistance. Our program is non-medical, so we don't do particular things like direct medication management or like wound management per se.
So the people, oh, I'm sorry.
Well,
So the people through that agency aren't registered nurses or LPNs?
they're home care aides, so they do have a nursing supervisor that will oversee their training and such. Our Association on Aging is working on becoming a recipient, and the terminology escapes me right now, where they're trying to establish themselves as, I believe, a 501c3, where they can actually work with insurance companies and be able to receive revenue from insurance company for services rendered. So the overall picture is hopefully that the money would streamline through the association who's already set up in that capacity, and then funnel it down to local agencies.
So generally, right now, you know, service people that don't have insurance would cover, you know, aftercare after you get out of the hospital or whatever the needs are.
So having insurance for our personal care, these are great questions. Having services, providing our level of services, we don't require people to have insurance per se. We are, the one piece that we, through Office for Aging, that we do provide is we provide non-Medicaid. We serve non-Medicaid individuals. So if individuals do have Medicaid as their insurance, then we would refer them to Medicaid for the personal care services versus going through Office for Aging through our department. Our department is really set up to help those that are like way above the threshold, but again, can't personally directly pay for the service.
Thank you.
You're welcome. I welcome any conversations after too, with any scenarios. and such.
Just I don't need to know exactly how the sausage is made.
Probably just as well.
They're great questions.
Any other discussion? So we need a motion to change the,
I think it's for the waiver. right?
The waiver. The waiver. it has to go to finance. Sam? Second? Okay, all those in favor?
Aye.
Good.
Okay, thank you. And one last item, just to let everyone here know that I will be submitting a budget transfer request to the budget officer, basically to really just clean up the 2023 budget between the line lines.
Thank you.
Thank you.
Okay, next we have Youth Bureau. Sue?
Morning.
Oh, sorry.
Oh, wait.
Okay, first on my agenda is to, I'd like to nominate someone to become a member of our youth advisory board. And she is a youth. Her name is Jaden Mitchell. She's a Fort Ann Central School 10th grader. And to apply for the position, she had a wonderful essay and she was able to sit in on our youth board meeting we had for this funding stream. So she seems like she would be a great fit, and she also became a lifeguard at our last lifeguard training, and she'll be probably working at Fort Ann Beach. So,
With Anila.
wonderful young lady.
Motion. Sam, second, again. Discussion. All those in favor?
Aye.
Opposed? Motion passes.
And then the next bit of business that we need permission to send in our resource allocation plan, otherwise known as the RAP. And that plan gets submitted to OCFS, Office of Children's Family Services. And then they review the programs that fall into the different funding streams. And then they approve the plan, hopefully send it back to us, and then we can contract with these programs. So the first set of funding is called the Youth Development Program funding, and that's the YDP funding that goes to your town recreation programs. And that's been fairly consistent for the last 20 years that I've been working here. And that's a funding stream that is long-term funding, and then the towns do provide the youth recreation. That did not change. It remained flat. Last year, the only difference was it was that 9-month transition year when they were changing the year. The state was changing the year. So we had a 9-month faction, but really it's the same allocation as in 2022. And then another funding stream that has been around for over 20 years is the Runaway and Homeless Youth Program funding. And that's funding that's Warren and Washington County funding. Washington County does the administration piece, and that's really the only place that is eligible to receive the funding is a homeless youth shelter, and that's the Wade House. So that's the Runaway and Homeless Youth funding stream. And that has increased. Last year, they saw a big bump, and that has increased over the last couple of years. They've seen a bump in those. Yep.
So when you say the administration also has responsibility for not monitoring the funding of it and how the money's spent?
Yes, that's exactly it. So each year for every program that's listed on these pages, somebody from our office goes to make sure that they had the program that they said that they were going to have, that they, for the Homeless Youth Center, we're also the coordinator of services for the Homeless Youth Center. So we have to be, any youth that stays in the shelter for over 30 days have to be reviewed by our office, and they review the paperwork along with OCFS and all of those things and we provide a certain amount of match towards the funding for the Runaway and Homeless Youth funding.
Does that match some of that comes from Warren County as well? Does that help?
Yeah, so Warren County, I think years ago, never wanted to be the administrator of the
Right.
funds, as I've seen over the years. So we just took on that role so that we could get the funding.
Gotcha.
I think if somebody needed to step in and take that role for that particular funding stream. So those two are what we have been doing for many, many years. And then 3 years ago, the state added funding that was called Youth Sports and Education funding. And this will be the third round of that funding. Each year it increases. It's the one that's the funding stream that's tied to the mobile sports betting. So we don't know how much more that will increase, but we know it's increased every year. First year we funded the Challenger program in Hudson Falls. Last year we funded the programs that were listed. And then this year, we're funding the the programs, if you approve, we're funding the Argyle Youth Commission, Queensberry Rec, Hudson Falls Baseball, softball, Salem Lunch and Learn, and Whitehall Rec with this funding. And we're funding everyone who applied in some way or the other. Some of them qualify for the youth sports and education funding. Some of them qualified for youth team sports, which was new this year. So youth sports and education, traditional funding, we expect that will continue and probably increase a bit. This year, we also received $10,344 for an infrastructure. So something that's a one-time shot. We don't expect that will be around next year. And that Whitehall Rec really wanted to improve their softball, baseball field, and they need fencing and dugouts. And so our suggestion is that we give the funding to Whitehall Rec. And then that leads into the youth team sports, which was new for this year. We do not expect it for next year, but we really don't know. It was supposed to be a one-time shot to support programs that have a team component in which 2 or more play against 2 or more. So this was the allocation for those that have applied for funding. And we were able, based on the number of applicants, to kind of mix and match a bit to make them whole for what they had asked for. The only questionable may not get approved by the state. It will be the Southern Adirondack School Play Target Association. It meets the qualifications, but I'm not sure that we'll get state approval. So we have another program to potentially that really wants funding for next year that we may have to come back and ask to fill that with. I'm hopeful that they'll accept that program.
So how would, if a town, let's say 40 wants to apply for a youth sports education program?
Yeah.
How do they go about that?
So we sent out email and we had Facebook and we had a few informational sessions for this past year to kind of, the state was a little bit late on giving us the specs. So once we got those, we had some informational sessions in which we identified several people that didn't want to apply for it this year, but want to apply for next year. So I would say reach out ASAP. You can reach out. We're already getting our list ready for next year of those that want funding.
I'll probably throw myself under the bus here after this question, but who do you send those emails to?
You can send them either to myself or Leah Breer, or we do have a youth bureau email.
I mean, the notice that you guys send out to tell the towns.
Oh, so each town and village recreation program, our contact person received that information.
Okay.
And then we're in the process of developing like a resource book of all things rec. So we're hoping to kind of have more of a broader, to include like little leagues and football programs and soccer programs and those types of things that would also qualify so that it can go out far reaching. So that's kind of our process. So I would need permission to submit the application with these funding recommendations.
So can we have a motion? Anna? Second by Sam. Any discussion?
Just one quick question.
Yep.
The Wait House,
Yep.
is that an agency that's supported by Warren, Washington County? Is that like a public agency or is that a
It's
private company?
It's a not-for-profit organization. They receive funding. It is supported by Warren and Washington County. Warren County also gives Wait House dollars using different funding streams. So, and then the Wait House also has private donors that support them. It is a program that will accept youth from both Warren and Washington County and some of Saratoga County. So they cover the area. Right now, the last time I talked to Jason, the director, I think they're pretty close to being full, and they have two sides of the White House. They have the homeless youth shelter that serves traditional kids that don't have a place to stay. And then they have the other side of the house, which serves pregnant and parenting youth. So they have availability, I think they have 8 beds to serve either pregnant women or women with kids that are under the age of 24, and they can stay on that side up to 2 years. They could, and then transition. The goal is to transition them out. On the shelter side, it's usually a 30-day stay with the possibility of getting another 30-day extension.
Does Saratoga kick in for this too?
Saratoga, I don't believe does, and they really, and when I say they serve parts of Saratoga, they oftentimes, if a youth doesn't qualify for our shelters, we'll sometimes use shelters of Saratoga and vice versa at times. So they kind of work together in that way. And when I say it's usually South Glens Falls, where we have some transient youth who may really be in Warren County or Washington County, today, and then they're in South Glens Falls or stay in South Glens Falls. So it's kind of that,
Over one hand washes the other.
yes, very much so.
Chairman Henke.
There's something specific that's giving you an indication that you're not on the lake target.
Yes. Yeah, so one of the other youth bureaus down south, I can't remember if it was Dutchess County. They asked the question first. They contacted OCFS. They had a very similar program, and they specifically asked them, can they apply for the funding? And they said, well, we don't really suggest that they apply for the funding, but this program meets all of the specs for the funding. So that's the only reason I say I'm wondering what they'll do once they have the applications, if that makes sense.
It makes sense, I'm just trying to drill into a specific person to deal with.
Yeah, not a specific person yet. It was just in the informational sessions when another youth bureau asked that question. Can we fund a program that's a shooting sports program? And they did not say no. They said, we really highly suggest that you don't send that in.
Other kind of person being,
It may have been, because really it does meet the specs. It's a not-for-profit, it's a team,
Chairman, I'm gonna go back and look at some of the documents. I recently got something within this last week. Talked about contamination from those types of things, from leads and the clays and all that other stuff.
Oh, yeah, they got, that's one of the bills we're in.
Okay, well, I guess that's where I read
Yeah,
it.
yeah.
Probably so. Okay.
There's a couple of different tries that they're trying.
Right. They did fund last year an archery program, and then this year we have another application from Argyle, which they wanna do an archery program.
Any further discussion?
Well, just, I guess, does this need to include the finance, or just one of those just approve ourselves? I don't know the answer to that. That's what I'm asking.
Yeah, just approval.
So, okay.
Then I'll have to come back
Gotcha. Okay.
after approval to get permission to contract with those agencies over the dollar amount that.
Any further discussion? All those in favor?
Aye.
Opposed? Motion passes. Thank you.
Your resolution for the advisory board, I actually had 2 people on it. You're going to talk about.
Who else did I have on that? Sorry. I thought we already did you. Okay, so we have these, thank you for catching that, and I didn't take a look at that.
I can take all the
before I
credit
came
for it.
up. We would also like Eliza to be a member of our youth board. She also sat in on our last youth board member, so we would also recommend. Thank you.
All those in favor?
Aye.
Opposed?
Thank you, that was a good catch, thank you.
Thank you, too.
I couldn't remember if it was Jessica either. I was like, oh, we've already done that.
That was a nudge word, I think.
And other business, we have, Department of Social Services, Tammy.
Commissioner, I think we were saving all our no votes for you.
Good thing I'm not asking for a lot. Well, I can't believe you didn't ask for that. This is the county plan, not a DSS one. But I did ask to be put on the agenda to be able to speak to the purchase of vehicles. So when the budget process was in place, it really isn't something that DSS necessarily needs more vehicles, but it is the county plan to keep replenishing the carpool through the vehicles that DSS then releases once we get new ones. So it keeps later model vehicles. We were able to purchase them and use the revenue streams that DSS has access to. We also keep then, of course, our staff are able to travel the county, the back roads and everything in later model vehicles. So that hopefully it's more likely that they'll come back to us as well, or not need to have the DPW go out to rescue them. So those two things certainly assist us, but then it is about when we get new ones, the others, 3 more will come out of our pool and go to the county park pool. So it was budgeted for up to $120,000. The bid, we were piggybacked in with the DPW. I believe that this was discussed yesterday. So it's originally, we'd like to be able to accept the lowest bid, which came in through for 3 Jeep Renegade Latitudes. They are $26,534 each. It's a total of $79,602.
No, one that's approved here, just straightforward.
Sam,
Dana, move it first.
Dana, then Sam. Discussion? Yes, sir.
Jamie, are you sure you don't want to request the wrap?
Iris?
They were not bid. Thank you for that offer though.
They were bid for DPW.
I'm good.
Any further discussion? All those in favor?
Aye.
Opposed, motion passes.
Okay, and I'll just mention that I too will be passing along a budget transfer request to the budget officer to just clean up the 2023 accounts.
Thank you.
Thank you, Tammy.
I do have one question. What happens, so you came in well under budget on those vehicles, what happens to that extra money that was spent?
I get to keep it.
I like that.
That's why I asked her if they wanted to change it to the wrap.
It will stay there, and in my opinion, it's up to the county, if the county wants to leverage it in some other way. However, you know, truth be told, if somewhere down the road, we end up going over what we budgeted in some other category, we will then ask for a budget resolution to make a transfer, and that would be one of the areas that we would ask about.
That's where we're at.
Yeah.
All right,
Thank you.
thank you. The other business? Okay, we're adjourned. Thank you.